Okay, Mr. Mayor, we are live and ready.
Okay, we'll go ahead and try this again here. We'll go ahead and call the meeting to order for a regular meeting of the Seldovia City Council, Monday, October 26th at 6 p.m. Roll call: Sweat,
Here.
Colberg,
Here.
Morrison,
Here.
Rojas,
Here.
Nathan.
Here.
Okay, we do have a quorum. Will everyone join me in the Pledge of Allegiance, please? Pledge allegiance to the flag
To the flag
of
of
the
the
United States
United
Of the
States of
United
America,
States of America.
and to the
And
republic
to the
for which
republic
it
for
stands,
which it stands,
one nation,
one nation,
under
under
God,
God,
indivisible,
indivisible,
with
with
liberty
liberty and
for all.
justice for all.
Excused absences, we have none. Agenda approval.
I'll make a motion to approve tonight's agenda.
Second.
Do we have any amendments to the motion? You're on mute.
Sorry. I make a motion for request for an agenda amendment to remove item J1, ordinance 2105-05, and add item J4, resolution 21-12.
Do we have a second?
Second.
Second.
And I'll entertain a motion for the amendment.
I'll make a motion to approve the agenda as amended.
Second.
Whoops, sorry, my mistake. My mistake. Okay, we'll go ahead and vote on the amendment. All those in favor? Sweat,
Aye.
Holberg,
Aye.
Morrison,
Aye.
Rojas,
Aye.
Nathan.
Aye.
Okay, the amendment passes. Back to the main motion to approve the agenda as amended. We will entertain a motion to approve the agenda as amended.
I make a motion to
Make a
approve the
motion to-
agenda as amended.
Second.
Second.
All those in favor, Sweat,
Aye.
Colberg,
Aye.
Morrison,
Aye.
Rojas,
Aye.
Nathan.
Aye.
Agenda as amended passes. We'll move on to the consent agenda. Tonight's consent agenda consists of the approval of minutes for the regular meeting October 12th, minutes of the special meeting on October 20th. We have no payment approval report and no ordinance introduction. Does any member wish to discuss any of these items separately? Hearing none, I'll entertain a motion to approve the consent agenda.
I'll make a motion to approve the consent agenda for this evening.
Second.
All those in favor, Sweat,
Aye.
Colberg,
Aye.
Morrison,
Aye.
Rojas,
Aye.
Nathan.
Aye.
Consent agenda passes. Mayoral proclamations, none. Public presentation prior notice. Each presenter will have up to 10 minutes. Tonight we have Dr. Ann Zink, Chief Medical Officer for the state of Alaska, and we will also suspend the rules to allow Dr. Zink to take any additional time as needed to answer questions and or give her presentation. Heidi, I'll go ahead and turn it over to you.
Thank you, Mr. Mayor, and thank you, Dr. Zink, for joining us this evening. I had reached out to you previously at the request of a council member just to get a little update on where we are with the state. We know that the numbers are getting larger every day. So hopefully you can give us some wisdom and your thoughts on how we can help flatten that curve a little bit in our area. We are experiencing a few cases locally. Today we had another press release for a case that was local, which is kind of new for us. And then more than that, now that we are able to get information or have the state share information with us, I think a few members of the council and the public were a little bit more curious about that process and how that information flow works from the state to the smaller communities.
Great. Thank you so much. Thank you, Mayor. Thank you, Council. Thank you to your town, your community for being here. And thank you, Heidi, for helping to set everything up today to be able to have me on here. I find sometimes these conversations are the most useful because I can really hear what's happening on the ground and what's working and not working. And we are here to support you in what this looks like. So as Heidi mentioned, we unfortunately really are seeing a surge of cases, not only in Alaska, but in the United States and in the world overall. We are seeing a huge surge in the European Union right now. India is starting to settle down, and the lower 48, particularly in the Midwest, has been surging rapidly. So South Dakota, North Dakota, Montana, Wyoming, Idaho, Missouri have a lot of cases, many more per capita than even New York or Florida or Texas had at their peaks. Part of that's probably due to some degree of testing, but we also think a lot of it is doing because of rapid spread and really just COVID fatigue. People are tired and done with this, and I totally get that and what that looks like. Alaska is following suit. So we are the 10th in the nation right now for the most cases per capita. So we are on a sharp increase, and we are rapidly increasing. So people probably saw over the weekend, we had over 300 cases one day, over 500 cases the next day, over 300 cases today. And looking like tomorrow's numbers as they're rolling in will probably be somewhere at, in the mid 300s again tomorrow. So we continue to see widespread community transmission. This isn't one outbreak. This isn't one area. The only place that I would say it's any different, kind of been down in the far southeast is a little bit more calm right now, but really within most of central Alaska. And what we've seen before, when we start to get cases in one place, it's just highly contagious and it can spread from other places really quickly. There's some, good things in everything that we're seeing. So since the beginning of the pandemic, in general, we've seen the chance that you will require hospitalization and the chance that you will actually die from COVID going down over time. And that's both in our state and nationwide. However, we're seeing cases increase, and we're seeing more long-term effects now that we understand COVID a bit better. I oftentimes say I'd rather COVID today than I would 6 months ago, but I would rather COVID 6 months from now than I would today. Every day we learn more about it, and the more we can kind of slow the spread of this disease. I think, unfortunately, the fatigue has really settled I've gained a new appreciation for the understanding of the word fatalism, in the sense that, well, it's just going to happen and I can't do anything about it. And unfortunately, that is causing fatality. That is causing people to be hospitalized and to die. I think it's important to remember that this pandemic, while highly contagious, is not something that happens to us. It's not an earthquake that we have no control over. This virus does not live if we don't give it a chance to spread from person to person. And the only way it replicates is with human cells to do so. And so we actually have a lot more power over it than we think sometimes. And so the more that we can be encouraged and inspired to keep our communities safe, our elders safe, and minimize the spread, the better off we are. Although the ways to do that are challenging and they're not perfect. It's one thing to talk about staying 6 feet apart. It's another thing to actually have to do it. I was working in the emergency department this weekend. It's really hard to sew a laceration 6 feet apart. You just got to be closer. And it's really hard to do CPR without being right there next to a person. And so there's essential work that we all must do in different ways that does involve being close. And then there's also essential connection. And I am concerned about the mental and physical health of Alaskans as we move into the fall and winter in these surging cases. I think that the prevention paradox, the sense that you can't see what has been prevented, is real. We have saved hundreds of lives collectively as a state so far, and we have the chance to continue to save that. And what we do between now and really spring will determine our history in this pandemic. This won't last forever. This will end. In the way it will end, if it will become endemic and kind of circle like influenza, we don't know. But we know that we will gain a place where we have settled into it. I do think that there is tremendous hope on the horizon for vaccine options. We have a vaccine plan that we've submitted, and actually all states have submitted about a week and a half ago to the federal government. And there's multiple vaccines, and actually 10 vaccines right now that we're tracking in phase 2, phase 3 clinical trials with really promising data. where we're seeing good immune response. We are expecting for and preparing for limited distribution for the highest risk people, really by the end of November, December-ish time. We want to make sure that it's number one, safe. And then number two, to a degree, efficacious. You don't have to have a perfect vaccine for it to be really useful. And I think that we need to continue to think about the different ways that we minimize the risk. The other thing I just want to emphasize is the fact that I think that as COVID has gone on, we have become increasingly polarized into ways that we think about COVID, between safe or risk, or death or life. And the reality is it's much more complex than that. Most people do very well. 40% of people probably are asymptomatic and totally fine. Many people, it's a very mild cold, or they just feel like it's allergies. And then other people get much sicker. Between the ages of 1 and 15, you are more likely to die from influenza than you are from COVID. However, less than 1 or greater than 15, you are more likely to die from COVID than influenza if you get it. The other thing is this is more contagious, so it spreads much more easily. It lasts on surfaces much longer, as well as the fact it has a much longer incubation period. And so those things are making it really challenging to slow the spread of the disease. I like to think of all the things that you all are doing and all of these, quote, mitigation steps as kind of like speed bumps. Although I was on a call with the YK Delta and they said, I think potholes makes more sense for Alaska than speed bumps. And I was like, that's probably true. So maybe we can think of it in terms of potholes in the road to slow things down, to slow the spread of it. And so no one of them is going to be perfect, but a mask is a speed bump or a pothole, and distance is another one. And travel testing when people come in is another one. And a vaccine is going to be hopefully another really big one in slowing the spread of this disease overall. But they're best done in combination, and they're best done in collection. Otherwise, a community like your own, where you don't have many cases, it can go from 0 to 60 really quickly. And that's what we're seeing right now in our rural villages, is where, there hadn't been any cases. Somehow a case gets kind of around a travel mandate or a restriction, oftentimes because the test is not perfect and or it hasn't picked up enough viral load at that point. And then there aren't speed bumps along the way as people are mingling and hanging out and being indoors. And then by the time someone's symptomatic enough to get tested, it's spread to 10, 15, 20% of the community. And we have a lot of cases in a short period of time. So the more that we can each individually build in these speed bumps to slow the spread of the virus, the quicker we can catch it, and the more we can kind of box it in and prevent it from spreading, particularly to those who are more vulnerable. So I'd be happy to answer any questions, talk about any more numbers. I could talk COVID until I'm blue in the face, but I know that the mayor probably has lots of other good work that needs to be done too. So I also want to be respectful of your evening in time. And I'm happy to talk through the process of the, requested information, if that would be. I know this has been a big issue for your community. Okay, I see a couple nods, great.
Yep.
This has been a huge challenge. So the state has regulations that are more restrictive than HIPAA. So HIPAA is the federal guidelines for sharing information. And the state regulations have been much more restrictive and have prevented us from really sharing information where anything could be potentially identified. In previous outbreaks that have been really identified as any community of 1,000 or less couldn't be shared publicly. There's no magic number to 1,000, but that's how it kind of been set previously. We have heard and appreciate the concerns. And I think one of the real challenges is, you all are being asked really hard questions about mitigation and protecting those that you know and love. And if you don't have the information to do it, it's really hard. It's really hard to make those decisions. And we want to make sure that you have that information. And it's really been fascinating how different communities have found different ways to do this. So first of all, we always encourage having the community work with each other as much as possible. And this is coming up a lot now with employers as well, where employers are calling us wanting the results of a test. And, we can't disclose that just because they want to know if Joe went to a party and what it looked like, because that was their outside. But what if it's a case at API and it's an employee who's then working in a high-risk facility? This is a whole new gray legal world that we're all trying to figure out together. We don't want to stigmatize COVID. We don't want to identify personal health information. However, we want to make sure that people have the tools and resources they need to protect. So the easiest way to do that is when people are willing to talk about the information and share about it, sharing with the employer, sharing with their community, and knowing what that looks like. If people are doing testing locally, we've seen, for example, a pediatrician's office who's doing a lot of school testing in one community has everyone sign a waiver saying that they can release that information to schools. So if you get individuals being willing to release information, there's a lot of ways to locally work around those limitations just right away and quickly. We, based on the feedback and real need to get better information out to communities, passed emergency regulations, which have been in open comment period as well, to try to provide better information. It isn't being pushed out, so it's not a required pushing out of information. It's permissive. So it's, if this community or this tribal leader or this healthcare clinic needs to know the information for some reason, there's kind of 4 major reasons why that information can be shared. And it really has to do with if you have the ability to truly mitigate the spread and protect others with that information. So we're not sharing information just because someone wants to know. We're sharing because they actually have the authority to do something about it and to protect others. And so I just want to kind of make sure I'm clear kind of about that process. We found different things are working well in different areas. So some are working with their public health nurse and getting the information directly. Some are working with our EPI team and getting information, but most communities, people are working directly within the community to have a good sense of what those cases are and look like, so that people can say, I tested at this clinic, and this is how many we have, and everyone reports that information. When it comes up to the state level, from my perspective, it feels a lot like trying to understand what's happening from a 30,000 foot view. We have, about 600,000 tests coming in, all of which way, calls and fax and ELRs, and everyone's like, well, you didn't get my test from 30 minutes ago in that spot. And oftentimes it's just because maybe it hasn't been reported or it isn't there. So the more a local community can work together to share that information and be able to respond, I think the quicker you'll be able to respond to a case. And the other thing that we see in the data is that the longer you get from the time of infection, the beginning of their infection, to contact tracing, the less impact that contact tracing does. So if you're beyond 6 days from the onset of symptoms, contact tracing really doesn't do much at all. You have to contact trace twice as fast for this disease than measles to be able to set the outbreak. And so the more local communities, they get the test right there off the machine, or they get it called back, and they can start the process of contact tracing and working through with that individual who their contacts would be, that can make a really big difference in getting those contacts in quarantine quickly. We did change our testing sheet yesterday, day before. And on it, it has like what to do if you get tested. And on the back, it has a way to list your contacts so that you can identify when you're infectious, which is 2 days prior to the onset of symptoms or 2 days prior to your test, whichever one, if you're symptomatic or not. So it kind of breaks it down so you can write that out. And so the more we can empower individuals to notify their contacts and be able to work that through that process, the quicker we can get them in quarantine, the faster that happens. And sometimes that's public messaging. Sometimes that is another community. It was, the healthcare team meeting on a regular basis. Sometimes it's trying to figure out better access to local testing so that then they can really control the testing, like get it in right away and be able to get those results back out right away rather than waiting to get them reported. There's a bunch of different ways to go about it. So I wish it was a more specific answer, but every community is really different in how it's set up with its needs, and tribal versus non-tribal versus municipality versus, different public health authorities that everyone has, and then different way the clinics kind of run, and every community is really different about it. So that's where we're at with that. And those regulations have been changed to try to make it easier to provide information to local communities. Is that helping you all? Is it not? Curious how it's going.
Yes, thank you, Dr. Zink. That was very helpful and much appreciated. That's certainly something that I've been saying these last couple of weeks as we have started kind of seeing cases come into the area, is that we are working really hard to partner with our local healthcare providers, with businesses, with people of the community. And even with those channels, I'm noticing that information comes out faster, or we're seeing it faster locally than what we like. The case that today is not going to be reported through the state data until tomorrow. But because we're able to have these close partnerships with the different entities in our area, we're able to get that information out sooner. They're able to follow through with contact tracing sooner. And that is really helpful. It's great to know that, because if there is that random case that might be in the area, but we don't have information for, that we can go to the state and get that information. And I really appreciate that, because I do think that it's important that we can collect as much data as possible, especially if there's a concern for the area. But I liked how you summarized the information sharing process. And I have found that on the ground level certainly is a lot smoother and faster, typically, for information sharing.
Yeah, thank you, Heidi. And Dr. Zink, I appreciate all the information there. Yeah, obviously, all of that information is of extreme value to the community. And it's making us, understand that, yeah, we are, like every other community in Alaska, we're not exempt from this virus, and it's given us now a tool to know quickly and efficiently that it's here. I think a lot of people are, starting to change their behaviors, because of that. So, yeah, it's nice to have real time information when things are happening. So, I'll open it up. Anybody else have some comments or questions?
Mr. Mayor, if I may?
Yeah, George. Yeah, go ahead, George.
Dr. Zink, I really appreciate your responding as quickly as you did, and I'm a little disappointed. I had about 1,000 questions for you, and you've answered every one of them already. Just one other thing, I'd like to ask you a little bit about the therapeutics that are being used today. Are we making any progress there? And also, how about the quicker results from tests? Aren't there some 15-minute tests around that would help us quite a bit in a response time, a timely response to these positives?
I appreciate both those questions, George. They're great. And I do think sometimes we don't talk enough about therapeutics as a doctor. Like, that's where I get really excited, because I'm like, oh, these are other things that I can do rather than just like data sharing numbers forever. So yeah, a couple of things about therapeutics. I think about it in kind of 3 different, or actually really 4 different phases. There's before you get COVID, there's the as you have active virus of COVID, there's what's called the inflammatory phase, and then there's the post-COVID. And so each one of those phases has different treatment options and different things that can be done. So the prior to getting COVID, a lot of that is making sure that your health is well cared for. So it's controlling your underlying medical conditions. If you have underlying diabetes, hypertension, COPD, making sure that that's well controlled can help. Making sure that you're not vitamin D deficient. So vitamin D deficiency looks like higher rates of hospitalization. We haven't seen mortality difference in that, but that's another thing you can do. Obesity is a huge risk factor. A clinician that I know has lost 100 pounds since this pandemic has started because he saw it as such a huge risk factor. And so there's a lot of, it's gone on long enough that weight loss is an option as well. Initially, that was not like something we were, totally focused on, but as COVID has gone on, a lot of things like that can make a big difference. So that's all kind of the pre-exposure to COVID things that you can do to make sure that you are healthy and well if you get COVID. And then there's making sure you get as minimal virus as possible. And so all of these mitigation steps, like wearing a mask and staying distance, there's some increasing data that a mask reduces the amount of virus you get. And that if you get a whole lot of virus, you get a lot sicker than if you get a little bit of virus. And so I think it's part of the reason healthcare workers, particularly at the beginning, were getting so sick. And it's just because they were exposed over and over again to really high doses of virus. And so you're more likely to be asymptomatic or mildly symptomatic. And there's some discussion if that's part of the reason why hospitalizations are going down despite cases going up, is because people are wearing masks. And so they might be testing positive, but they're doing much more okay because they're getting this like little tiny viral load, which may be enough to like build up antibodies, which is awesome without making you super sick. So it's like old school vaccine. Like that was kind of like what we did with smallpox and cowpox, like to give you a little bit of the virus and see how it goes. And so again, I'm not encouraging exposure, but we do think a mask may be playing some role in that. Now, during the viral phase, that's when people are producing a ton of virus and they can get quite sick that time. Usually not hospitalization, even for older people at that time. And the biggest treatment option we have there is a medication called remdesivir. You've probably heard a lot about it. In the news, we have been fortunate in Alaska that every patient who has needed remdesivir in the state has been able to receive it. Not every state can say that. And again, part of the reason why I say like the more we can slow it down, the more like we can have, resources like remdesivir if people need it. The other thing is there's a lot of talk about what are called monoclonal antibodies. And these are essentially bits of the ability to fight the virus, the antibodies to fight the virus that are manufactured in the lab that can be given. So Trump, for example, received monoclonal antibodies as part of a study project. We don't have that study going on in the state of Alaska. We were told this week to expect an EUA announcement. So there may be treatment options for monoclonal antibodies on the forefront. That has not happened in the state of Alaska yet, because again, we're not part of a treatment study, but there's a lot of movement, and monoclonal antibodies have been used for other things and show a lot of promise. So that's useful. The other thing is what's called convalescent plasma. So if someone's recovered from COVID, they can donate their blood. It's cleaned out and the antibodies are given back to someone who's sick. And so that can also be used during the viral phase to kind of suppress the amount of virus. And so those are all treatment options. And our blood bank in Alaska does do that. And we encourage people who have recovered from COVID, they're no longer infectious, to consider donating, which is geographically challenging in the state because right now it's really only in Anchorage. And so that's a huge challenge. But if you happen to be in Anchorage and recovering from COVID, you can donate plasma to be able to share that. And then there's the inflammatory phase. So somewhere between 7 to 10 days, people either get much better or they get a lot sicker. And that's likely because their body's kind of overreacting to the virus. We think it kind of hides in the immune system and kind of confuses the immune system. And some people's immune system just goes haywire and they get really sick and they get much more short of breath. Their lungs start to fill up with a lot of fluid. They can't breathe. Their oxygen level goes down. They start to get more clots. And in that phase, a steroid called dexamethasone can be useful. And that is a medication that kind of suppresses the immune system. But you don't want to suppress your immune system before you get the virus or during the viral phase because your immune system is needed to suppress that virus. So that's why you have to make sure the treatment options are used at the right time. That medication has shown useful for people who are hospitalized to minimize the length of hospitalization and death, but only for hospitalized patients. So not steroids in the outpatient, but only people sick enough that their body's just really going crazy enough that they need to get that treatment. And there's a lot more promising, I can go for a long time about other options for that, but that's the main one that's there. And then there's this kind of post-COVID syndrome, and that's no longer infectious, but still not feeling well. The biggest thing that we see in that is clots. And so we see a lot of people getting clots, pulmonary embolisms, strokes, small clots, even months after they've been exposed to COVID. And so we think it kind of dysregulates the clotting system. Depending on how sick you got, there are recommendations for clotting or anti-clotting medication. And particularly people who are pregnant or other high-risk groups for clotting, there are recommendations for those groups. And then the rest of kind of the post-COVID treatment world right now is a lot of symptomatic care. So headaches, a lot of people will lose their sense of taste and smell for months after they're exposed. And that just takes a while to get back. We don't have any good treatment options for that. But there's whole clinics now being stood up to treat kind of quote post-COVID patients. We also see that even in young people, people's hearts can be inflamed and lungs can be inflamed. And so there's cardiology guidelines for returning to competitive sports post-COVID exposure to protect young people's hearts and lungs. So that's the really quick-ish version of the treatment world out there, with a lot of promise on kind of each one of those stages as we learn about the disease overall. It's been pretty cool to watch the whole medical community learn really fast. And it's messy, but it's pretty impressive how many great minds are being put into that effort right now. The next question is just about as hard, and that's what are we doing about testing and how can we make that better and how can we get it there? Again, I think of tests kind of like skis. You can't have the right set of skis for all conditions. Not every test is the right for every condition. And so we got to make sure we have the right test to the right person at the right place and the right time. And that's really hard to communicate large kind of public scale, but turnaround time matters. If it takes a week to get a turnaround test back, I've lost my window to contact trace. That's a big deal. And we have to get that turnaround time as short as possible. My goal would be that everyone had at-home testing that they could do on their own that was $1, like super cheap, so that it would be able to be available. We're not there yet from a technology standpoint, but we are moving that direction quickly. Every test has its limitations. No test is perfect. Some are more sensitive, some are less sensitive. You can also shed RNA particles for a long time afterwards. You can test positive even though you're not infectious, and that can be really confusing. And so each of these tests, depending on the timing, are important. The Abbott Now machines, because of all of our increased cases, we have been working closely with the company as well as Admiral Jawad from HHS. They're supposed to be delivered today, but they hadn't on my last email, an additional 50 more machines to try to get those out. Cepheid are the kind of big workhorse of a lot of our rural hub hospitals, and they are running really short, and the HHS had stopped supplying those altogether, and we haven't been able to secure them. In this week, we were able to secure 3 more months worth of supplies for that, so that is huge. And then we're trying to get these Binax Now cards kind of distributed, either these antigen tests that are pretty quick. They can be done in 5 to 10 minutes. They're kind of like a pregnancy test. They're a lot cheaper. They're easier to do, but they have limitations. They can have false positive. You can't use them for asymptomatic people. You can't use them for screening. So they're really good to be using when you have a lot of cases around and you have a positive person. So I just have to caveat each of these tests has its own role and own way to use it. And so we've been really trying to work with federally qualified health centers, tribal organizations, healthcare clinics, And if your testing team wants to talk more testing, I mean, we talk testing all the time. We'd be happy to talk about kind of what options are available there and what other options, what are the holes that we can fill to try to make sure that that whole quiver of options is available. But it might mean that you're using an antigen quick test for one person and an Abbott test for someone else. And then you're going to go ahead and send out that test for that person who's in quarantine, because they got to be in quarantine for 14 days anyway. And you swab them on day 10. And if it takes 4 days to come back, it's not a big deal because it doesn't change their life compared to really changing their life for someone else who may be the first person in a household, or maybe an essential worker who needs to work. So, trying to kind of match and mix the test to make sure that it's as available as possible. The other challenge I would say is we have no commercial labs in the state, like none. Most other states have all partnered with, big commercial labs all across. And so we've really had to rely on the state lab, which is really not designed to be like a super efficient machine for testing. They're kind of supposed to be the backup in hospitals. And so that's been a real limitation. We've been able to do it-ish. We've been one of the most tested states in the nation, but our percent positivity is too high right now. We need it less than 2%. We're not doing enough testing for how many cases we have right now. And so while we're still like fifth, I think, in the nation per right now per 100,000 in testing, it's not enough to slow the spread of the disease as well. And we also need to not rely solely on a test. They can be negative, and then you may be still growing virus, and a day or two later, you've grown enough virus that you can transmit it to others. So please remember that these tests are limited. They only tell you don't have a lot of virus in your nose at that moment. It tells you nothing about the next couple of days. And so I think that's part of the reason we're getting some of our bigger rural outbreaks is we've relied so heavily on testing that people assume I'm negative, I'm good to go, and don't realize the limitations of that test. Does that answer your questions, George?
All of them. Thank you very much. Sure appreciate it.
Thank you, sir.
Yeah, lots of good information there. Appreciate that feedback. Vivian, you had a question.
Yeah, but she's done such a great job. She's answered everything up. Thank you very much, Dr. Zink, for coming to us. I thought I heard you say that you thought in November, December, a vaccine would be possibly available to, and I missed it. I lost what else you were saying. If you could address that. And then also when you said, what are the reasons that there's less death and hospitalization? Is that because there are treatments that are being tried that are available and or less exposures?
Yeah, I appreciate those questions, Vivian, and great questions. So first of all, about the vaccine, we think that it will be very limited allocation in November and in November, December. What limited means, I've asked the CDC and HHS, I'm like, is that 1 dose or is that 1,000 doses or is that like 25,000 doses? Like, it's a really big difference in my planning. And they're like, we can't tell you. I'm like, okay. So I have no idea what that's going to look like. How many? We do have a committee that involves medical ethicists and providers from around the state who are helping us to kind of give input on allocation. And there's a bunch of national committees, the National Institutes of Health, the CDC, and then there's a big vaccine committee called NCIP, which is traditionally always done. Who gets first priority or not first priority for vaccine distribution? So we're watching that information, we're working with it, but then we have an Alaska specific group that's also looking at it. So when we had to submit our numbers for like how many healthcare workers we have, we're submitting community health aides. We're submitting people that other states are not going to have because we want to make sure that the reality of what's on the ground here is reflected in our data and numbers. The vaccine will also be coming like federally to like VA and DOD places. We don't know if it will be coming IHS or if it will be coming directly to us. Tribes can request which direction they want it to go. One of the vaccines is a negative 80 degrees cold chain storage, which is a huge logistical nightmare of trying to figure out how to do that across this amazingly beautiful, very large state that in it would only be in doses of 1,000, right? So again, we run into the 1,000 number and what that looks like. And that is not going to work for most of our state and what that happens. And so we're really, we're working, our vaccine distribution group is in partnership with ANTHC. So at every level, we're working with the tribes just because that's such a big part of our distribution in the state. 50% of our testing sites are tribally run, despite 15% of the population. It makes a big difference when we think about allocation to get out to small and rural communities. And so that's got to be a key part of our vaccination distribution. I would suspect that it's going to be healthcare workers who are actively working with patients who are most likely to be exposed to be in the A1 group, with a quick escalation into the 1B group, which may provide vaccine to other high-risk individuals and or other critical infrastructure, law enforcement, EMS, things like that. And EMS may be in 1A. So that's, there may be components of that. Also, people who are at higher risk, both with comorbidities as well as age, may be on there. These trials are not being done right now in children. So we do not suspect children vaccine for some time. As we talked about earlier, they tend to do much better. And so, the chance of them getting COVID and having a problem is so much less that that's not really where the trials are focused, and nor should they be focused. We want to get it to people who are going to not do well. And that gets to your next question. Why are hospitalizations and deaths changing? I think part of it is we're testing more people. So we're testing younger people in general, and they tend not to be hospitalized or die as much. So that's a big part of it. I think treatment options have changed a lot. It's impressive to me to see how different the ER works now than it did in March. We used to put a breathing tube right in. We thought people were going to die right away. They don't. They, have much longer. And you can try a lot of other things first, and they do better when you try other things. A lot of clinicians in the world and the country now have taken care of hundreds, if not thousands, of COVID patients. And so we have a much better understanding of what this looks like. And I think we're able to treat it much better. I also think people are getting lower viral doses, again, like with that mask and what's happening there. We do know that the virus has changed some. We do genetic sequencing on some of our samples, as well as follow that closely worldwide. We're actually one of the top 10 for genetic sequencing in the country per capita. So we always got that per capita thing going for us when you look at the total number of samples. But there's a new clade, kind of a new variation of it that came out probably about 4 or 5 months ago. We started to see it become predominant. So it looks like it's more contagious than the old chain. So the wild type it is less contagious. We're seeing it spread more easily than we saw it spread early in the disease course. However, we are not seeing clear evidence that it's less lethal. So if you get it, it was still similar just based on the virus alone, but we are seeing it spread more. So we're probably seeing younger people, more people getting it quicker than we were at the beginning. And we'll continue to follow that closely, but there continues to be debate about all of those factors. The US as a whole had deaths and hospitalizations go down. Really this last week, we are now starting to see a significant increase in hospitalizations and deaths around the country as well, starting to uptake. So I am concerned about what this looks like, because then we start to get into like supply limitations for, medications for intubation and all sorts of other things when we start to get a lot of people hospitalized. So really want to slow these numbers down so that we don't run into other constraints.
Thank you very much.
Yeah, thank you, Vivian.
Thank you for the information on that. I just want to jump in real quick. I have 2 quick questions. One is on the change in close contact definition by the CDC.
Mm-hmm.
Maybe if you could just give us a quick little down and dirty on that, what that really means in terms of the 6 feet in 15 minutes now apparently going to a 24-hour period, and then the or being counted in the aggregate. And the second one is back to the death percentage. I jumped on the CDC's website last night and I was looking at all the numbers, current case counts, and then doing some inverse math there to look at percentages. And I can't understand why. Alaska is one of the lowest. We're not the lowest, but we are one of the lowest. And at 0.4%, per 100 versus say New York at 6.6%. I thought, well, maybe let's look at populations with older retirement places like Arizona and Florida. Both of them, surprisingly, were just under the national average. National average looks like it's 2.5% or 2.5 persons per 100 on a death rate. So, any idea why the large gap in numbers?
Yeah, I think it's all about the denominator. It's what you see beforehand. So I think what happened in New York is you have a highly densely populated place, a disease that spreads asymptomatically until you suddenly got a lot of people who had it and it overwhelmed the system. And when you start to get a lot of people at once, particularly in the public hospitals, you are having one ICU nurse take care of 10 ICU patients. The normal ratio is like 1 to 2, like one nurse taking care of 2 patients. In the private hospitals, it was like 1 to 4. And when you start to overwhelm the system like that, you can't give the same sort of care. And so I think particularly in New York, it was so dense, it hit so hard, and so many people went at once that you had a lot more what we call excess deaths than you saw in even other places. There was a good JAMA article recently that looked at, quote, excess deaths. And it's kind of amazing how how much you can kind of predict how many deaths there will be a year to year across the country. And then if it varies from that, you can see what are called excess deaths. And that's a way that's really how we define an epidemic or a pandemic. It's like, well, we're seeing a lot more than we would predict at this time. And what that really showed is that when you had a bunch of cases in a short period of time in New York and the East Coast, for example, you had a much higher excess death rate, even per capita, and your case fatality rate was much higher. Versus in Texas, Arizona, and Florida, kind of that second wave, that curve was flattened out a bit. It still overwhelmed the healthcare capacity, but it was like a surge instead of a tidal wave. And so you didn't get quite the same excess death rate at that same time. And now hopefully with this third, and I think that's where Alaska has done well. And I think your geography has helped. Before it was like pop outbreak and then outbreak and then outbreak. And so if you've got that, you can kind of like bumble along the hospital capacity and not overwhelm it. You're right. I mean, we've had like the lowest case fatality rate in the country. I mean, that's quickly, unfortunately, I think going to start to move, particularly as Vermont and Maine are doing super well and we're surging on cases. But I think that's been part of it. I think the other thing that's been one of our advantages is not only the density of where we live, but the density of our long-term care facilities and nursing homes. We have the lowest rate of nursing homes per population in the country. And while that's been a major problem in our healthcare system for years, it is now being slightly advantageous because you might be having a PCA care for someone at a house or with 2 residents, but you're not having, a nursing home with 150 residents where you get it in and it spreads super, super quickly. So I think that those just kind of natural distances that we have, so you don't just get these big super spreader events, particularly in nursing homes, is making a big difference in our overall mortality, regardless of the underlying age of the population. Does that help answer your question, Mayor?
Absolutely. No, I appreciate that. Appreciate it. And then there was that first one, a little bit about the CDC the new CDC definition of close contact.
Thanks. I appreciate that. I just checked that one off my list and went to the one that I was kind of diving into. The reason I checked it off is because for us, it really wasn't that big of a change. It always said cumulative, but they didn't define what cumulative period that looked like. So it was unclear if it was cumulative in 10 minutes or if it was cumulative in 3 days or if it was cumulative in 24 hours. And so they just defined it as cumulative in a 24-hour period. We've always been working under the assumption there wasn't any biologic reason that would say that, 5 minutes here, 5 minutes there, and 5 minutes there wouldn't equate to 15 minutes all with one person at that same time. So that's how we've been doing our contact tracing. Waitresses are not happy with that. It's a place where we get a lot of back and forth where you get people being in kind of close contact. There was also a really good study that came out of a prison outbreak in Vermont where a guard, there was a prisoner who was positive and the guard had 18 different 1-minute encounters with him in a 24-hour period and turned positive. And I think that data was like the clearest data that we had on it was his only exposure. The prisoner was there. It was all timed in watch. And multiple guards got sick with these very short little interactions that were cumulative over a 24-hour period. And so that's why they kind of clarified that and said that 24-hour period. But for us functionally, it didn't really change much of what we were doing.
Okay, no, I appreciate that. I think what that did for us, I work in an office and, we've had a few folks starting to test positive, and if working in an office environment, when you limit your interactions, but then before we just look at, well, it was 15 minutes, but we didn't count it, in the aggregate throughout the day. And so now people are starting to explain to us, well, yeah, it's throughout the whole, it's throughout the whole day. So, which kind of changes it, changes folks to be a little more conservative on their interactions. So, but no, the health community probably already knew, but those of us that work out there don't want to heed that. But I guess that's the real deal. So.
Well, and I would even say from a health perspective, one of the real challenges is you are infectious. You could get other people sick 2 days prior to your symptoms starting. And so from a health perspective, even if those were aggregate over 2 days, 5 minutes one day and 10 minutes another, from a health perspective, that would still be a very similar exposure. I think the CDC just had to set it someplace. So if I'm thinking about my office, I would be thinking about all of those exposures and realizing that I could have someone asymptomatic for multiple days in my office exposing people and therefore, masking. There was a really cool, if you're an office guy, there's a little modeling that just came out from an architecture company, and they modeled with and without a mask on a symptomatic person who was coughing and not coughing, and distance and space and different ways to minimize it. I thought it was good.
Yeah. All right. Well, I appreciate that. All right. Who, anyone else have any additional comments?
Yeah, Mr. Mayor, I have just one quick question.
Yep. Go ahead.
Okay, yeah, Dr. Zink, there's been a lot of controversy, a lot of talk over the past however long about the vaccines. Some folks are saying we're gonna have a vaccine pretty quick. Some folks are saying, no, we're not. So when you say there's a vaccine gonna be potentially available, some doses by the end of the year, November or December, where does that information come from? Does that come from the independent medical experts around the country or from the US government?
Yeah, so I really appreciate the question. And I think there's been a lot of really good questions asked about the information. Part of it it comes from independent medical and it comes from the US government. So it's both. So what we want to do is we want to make sure enough people were enrolled in the disease, in the testing, vaccine tests. You want to make sure enough people were exposed to COVID, not exposed to COVID, to be able to see if the vaccines work or not. When cases were slowing down in the US, it was harder to enroll people and get enough people who were testing positive. With cases increasing, they're enrolling a lot more people and they're getting a lot more exposure. So that's actually helping expedite the data. And so that's part of the reason we're being told we're going to get more data soon. What happens next is when the vaccines have completed what are called double-blind controlled studies. So they have no idea who's in which group, placebo or vaccine, and they look to see, were they protected, who got COVID and who didn't, but also any side effects. They don't share any of that data. They look at some immunity data, but they don't show any of that data until the study is done because it's completely blinded. They don't want any bias in there. And then that is released initially to the FDA to look at it. And the FDA looks at it and says, nah, this isn't good. Or they say, yeah, I think this will be good. Once the FDA looks at it and says this can be authorized, it would be either an emergency use authorization or full authorization, depending on what the data looks like. That data then gets released publicly. And then that's where all of these other committees start to look at it, like the ACIP is an independent medical community who then would look through the data and say, looking at the data primarily and say, this is the group we'd recommend, this is how we'd recommend using it, or we don't recommend it, or what looks like there. Many states have stood up, like California has an entire set medical board that's also independently reviewing the data. We plan to use all of their work and do our own. So we plan to, collectively do all of that. We've been following the data studies really closely as well to kind of see what those look like and plan to see what happens. So we're just waiting for enough people to get enrolled and enough time to go past once they've been enrolled to see if they really got exposed to COVID or not. And we want to make sure there's enough. They also started enrolling people in the phase 1 safety data a while ago. So some of that data is now like 6 months. They've got like 6 months of safety data, which is great. And they're continuing to follow those people. And that will be like the first push out. And then they have to ramp up manufacturing. And that's where the federal government gets more involved. And so that's Operation Warp Speed. And that's where they have purchased a lot of ability to ramp up speed of vaccine distribution so that we could go from 100,000 or 300,000 doses to 700 million in a short period of time. And so that's a lot of the money that's been spent. And that was one of the major limitations with H1N1 influenza is it was hard to ramp up the vaccine manufacturing in enough time. So all of that is kind of done with those. And then what happens at the state level is we have to look at the data. We need to make sure we communicate it. And then 2, we need to roll it out and push it out. So one of the things that requires is providers to be enrolled in being willing to distribute it. So the federal government's not charging for the medication, for the vaccine. They're also not charging for the distribution. There may be an allocation, just an administration fee, but we are actively enrolling providers now. So any provider in your community who would want to be a vaccine distributor, we're actively enrolling them in a system now so that we know who they are. We're kind of all set to go. And then it's going to be complex because some of these vaccines are 2 doses too. So we have to make sure you get the vaccine on the right day and then you come back 3 weeks later and get it, which makes it much, much harder to distribute. And then we want to make sure that we're following people. There's this entire vaccine adverse reaction program, and we need to make sure that if anyone has any adverse reaction, there's an easy way to input that data so that we collectively build that data as much as we possibly can at the same time. So there's a lot of moving parts. There's never been a vaccine distribution that has been so complex in its so many different types all at once. But the data that's coming out is very reassuring, and I'd be happy to send you lots of virology podcasts and articles about it. That's at all interesting. It's pretty fascinating. The whole world's watching this super closely. In London, they're doing a whole vaccine study where they're putting healthy people in a room and actually inoculating them with COVID and seeing how it works and doesn't work. I mean, it's pretty fascinating to watch how the world is trying to understand this disease right now. So we'll keep you posted.
Okay, thank you very much.
Thank you.
Mr. Mayor, if I may, just one follow-up question on
Yeah,
that.
go ahead, Vivian.
Yeah, Dr. Zink, I guess for qualifying your answer, you hear on the news that and the experts and scientists are saying there won't be really a vaccine until next summer or fall. And is that what you're talking about stuff happening right away, but in the long haul, people really shouldn't expect that anything really should be coming out till late spring, sometime after that, because there's a lot that has to go through the process before it actually becomes common for the lay person. Is that correct? Am I understanding that correctly?
Yes and no. I mean, I think that
Okay.
it depends on, if the layperson is a healthcare worker at a long-term care facility, if they're over 65 with underlying medical conditions, if they're a state trooper, right? Those are all going to be higher kind of priority. Anyone who doesn't meet in those higher priority groups, yeah, it's probably going to be more like spring to summer before maybe there's larger distribution. But each one of those things matters right now, right? Like what we do now, part of it is doing it to protect ourselves, but a big part of it is also to protect our elders and our hospital capacity. And so if they're more protected because they have a vaccine, then those who are healthy cannot have to worry quite as much to not protect them, right? So there's this kind of stepwise process. I think of this like running this marathon, right? Like we are solidly at mile 15 and have blisters and are tired, but it will get there, but we just have to take it one step at a time. And I think there's a big water station coming up ahead with an early distribution of some. And it doesn't mean it's going to magically coin flip, done, we're over. But I think that it will go. And I think there will be some things that will always live with us. I honestly can never see myself working in an emergency department again without wearing a surgical mask. Understanding the role that we were all spreading influenza as much as we were to vulnerable patients, I will never do that again. And that, we now wear gloves after HIV. I think we will always be doing that in really high risk scenarios. But that's very different than what we're asking people to do now, right? Not visiting family and friends, not traveling, school, all these really big sacrifices that people are making right now. That stuff, I hope that we quickly unravel so much of that as we have more vaccine, even before spring and summer.
Thanks.
Yeah, thank you. Great question.
Okay, hey Heidi, we'll see if is there anyone from the public that has a question.
Yes, Mr. Mayor, I see Miss Laurel Hiltz with her hand raised. And Cassidy Cameron after that. I'm going to let Laurel on the line. Laurel, you're on the line now.
Thank you. Can you hear me okay, Mr. Mayor?
Yep, you bet, loud and clear.
All right. Thank you, Dr. Zink, for calling in. And I just wanted to concur with what Heidi was sharing today in regards to the local response to COVID positive cases. And so I work for Seldovia Village Tribe, and we have SVT Health and Wellness here. And it was just a great collaborative effort in terms of an individual getting tested in a quick manner. Once those results were identified, then that individual being very active in how they shared with people, the health and wellness with how they did contact tracing as well. And then the tribe and the city and public health, we actually partner with Lauren, Carol, and Homer for doing a joint release. And so then that news was was posted within a couple of hours, I would say, of even the test being positive. And to me, that's exactly the strategy that we want to see happen when we're able. Not always able to get things out in that quick of a turnaround, especially if the test does, have to go to the state or to get the result, and then you got to wait and it comes back, and you just hope that people are isolated in the meantime. But sorry, but truly, I mean, I think that was the best case scenario for a difficult situation, and I appreciate that you share and on a constant basis that the goal is for people to continue to live in a successful and healthful way. And so really big advocate for being outside and breathing in that fresh air. And I appreciate that you role model that as well. And just continuing along with that as we navigate these next 4 months where our darkest months of the year. We already know in our community with limited light that we have a lot that we have to navigate. And the council's heard me say it a number of times now, that resilience is super important. And so everything that we can do to support each other as a community, and understanding that we don't all agree. And so my big encouragement would be for our community in specifically is as we approach the elections, that the way that we respond to results of the elections, whether or not we agree or disagree, I hope that we will not heap coal on top of the struggles that people are already navigating with coronavirus and the anxieties that our elders are having to face every day because of it. So I just hoorah for the community. Let's do our best to continue this positive trajectory of supporting one another. Thank you, Dr. Zink.
Thank you, Laurel. It is really great to hear that local community response. I think it's also going to set you up well for vaccine distribution, right? When the community has figured this out, it's going to make it much easier to distribute that. And the more that can be done locally, the quicker you're going to be able to respond. So hats off to you all. It sounds like you guys did a great job with that case. And I wish I could keep track of all of the cases now. That was a day long ago. And now they happen with the team, but it takes all of us. So thanks.
Thank you.
Okay, Mr. Mayor, and now we have Cassidy on the line. And Cassidy, you're unmuted.
Yep, I see that. Thank you, Heidi. And hello, everyone. It's me, like a civilian over here. And thank you, Mr. Mayor, for taking my questions and opening it up to the public. Of course, thank you, Ann Zink, for joining our community again and providing all of that super useful information and that just real-time conversation, which I think is really, really valuable. I wanted to talk a little bit about our school district's Smart Start plan. We have Kenai Peninsula School District has a plan, and in that plan, a child cannot go back to school if they've had symptoms, a variety of symptoms, but any symptoms that are COVID related or any vomiting or diarrhea. And they can't return to school unless they provide a negative COVID test or 10 days has passed since the onset of symptoms. And I understand that. However, we received a letter, parents received a letter last week about reminding us of the Smart Start plan, but also let us know that our community health clinic wouldn't be able to do testing for our kids. And I'm wondering if there's an alternative source for our area, since we don't have an alternative testing site. A parent and a child would have to then go to Homer and incur those financial costs, but also time costs. Say if a child had a 24-hour bug and didn't want to sit out of school for 10 days or wanted to attend before that 10 days was up. Do you have any idea if the districts are going to be changing their plans to kind of maybe alter it so that when testing isn't available like that for our kids and for our families, we could have a different scenario? Or do you have any recommendations for maybe like home test kits, or if the districts are getting test kits? Maybe if you can talk a little bit about that and see what we could do for our school district, for our school. Thank you.
Yeah, I Appreciate that question, Cassidy. And you all should know that the regulations are changed, no small part due to Cassidy and her continual advocacy for making sure that that happens. She was fantastic at making sure that that never missed a moment. So I appreciate your advocacy for your community on that. Couple things about the Smart Start. Yeah, it's really hard with kids with just the one any one symptom. I would say that the same is true for adults. Like any one symptom can be COVID. I'm always amazed at how many times people say this. I thought this was just my allergies. I thought this was just my asthma, and it turns out to be COVID. So I would just, remember any one symptom, it can be very hard to diagnose. The only thing that's really clearly COVID and not many other things is a loss of taste and sense of smell. And so that's pretty specific to COVID. But besides that, it can look like I had a guy last night in the ED who was anxious and COVID positive. Like it's just, it's kind of crazy how many different symptoms can present associated with it. I think the key is trying to make sure that we've got rapid turnaround testing, because it's really hard to ask someone to wait 10 days. It's really hard to ask them to wait to go to Homer. It's really hard to say, don't go to work and it's going to take 4 days. As Laura said, like, no, I do not take any offense to the comment about the state lab. It is not designed to get these things back quickly. And it has been a pain to make that thing work at all. And so we have to find better options overall. I think what would be helpful is a community meeting with kind of either, I don't know all the people doing testing in your community. We've been doing these with schools specifically. I think antigen testing can be a useful tool for symptomatic kids to be able to consider what that looks like with a possible reflux testing. And again, the antigen is that $5 card that can be done really, really easily. And so that we have them, we are shipping them out. I think they're best done in combination with a clinician who can then have a good sense of like, is this the right test for the person or not? They're not good for just general surveillance. So again, I think using the medical team to look at what testing options you have, and then how else that can be expanded out to make sure that's done rapidly and quickly and I think the more diverse of a testing option we have, we're not relying on any one thing going down, that'd be helpful. So be happy to follow up offline. And Heidi, I don't know if you could help us coordinate or, what the best way to go about that is with our testing lead, and we can kind of talk through what you guys have so that we can figure out how to move forward. I was on the phone with Florida the other day, 1.7 million kids, and they are able to do PCR testing within 24 hours for all of their kids for any symptoms. And I'm very jealous. I was like, I really wish we had commercial labs here. But, and that's part of how they have been fairly successful, honestly, keeping their kids in school, even despite surging cases, is keeping kids out if they're symptomatic, testing early, masking and distancing is making a really big difference. Some really interesting data coming out of that very large state on what schools look like, and that mitigation works. That distance and mask, staying out when you're symptomatic, testing early works at preventing spread quickly.
Thank you so much. Can you still hear me, or am I muted?
You're good. I can totally hear you.
Awesome. Okay. My kids actually weren't behind me running around. Cool. Thank you so much.
Yeah. Look forward to another conversation so we can figure out.
Yeah, of course.
Okay, Heidi, anyone else on the public?
I do not see anybody else with their hand raised at this time, Mr. Mayor.
Okay, any final comments from council? Yep, go ahead, Pearlie.
To the same, I'm muted. When
Nope, we
we
can
come
hear you.
down and it seemed like the initial test was a temperature reading, doing it at airports. You got a temperature, you can't get on the plane, you don't have when you can get on the plane. Is how far into this, when you're asymptomatic, does the fever? Yeah, I mean, so all that testing was just kind of bogus, or what was the case with that? And today, just one follow. Today, my granddaughter got asked to leave school because she has the cold that's going around here. It's COVID symptoms. When are we going to stop traumatizing our kids? It's just seems like it's getting a little out of hand. I realize it's a virus and it's deadly to some people, but it's I don't know. I guess I watch a different news media than most people. So. is the fever still a precursor or?
So I really appreciate both of those questions. And first of all, I'm not sure HHS would have summarized it as bogus, but their summary of the airport testing was somewhere along those lines. I think that there was a real thought that fever was going to be useful. They are not sure all that fever screening caught many, if any, people. And so they were pretty clear that didn't work, and that fever screening. So that's part of the reason we never set up temperature screening in our airport testing, is because we saw the data. We think maybe about 50% of people develop a fever, and it can be multiple days into their symptoms. So they feel a little bit fatigued and weak and not like themselves, and they develop a little runny nose, and then a couple days later, and meanwhile, they've exposed people for 4 or 5 days. So that's the reason we don't use temperature screening in the airport. It was just kind of the time risk benefit. That being said, like the seafood industry used it on a regular basis because they were in a really tight congregate setting, and it was a useful tool to be able to do it. Hawaii chose to go with taking temperatures. Hawaii and I went around and around about this forever. And I was like, why are you taking temperatures? And they just like, they're only requiring one test. And they're like, it's one little extra piece of something that we think we can add. So it is a tool. All of these tools work together, but it's a very imperfect tool, and we can't totally rely on it. So we have not been pushing a ton for fever checking. I think symptom screening and making sure people don't come symptomatic is as important, if not more important than anything else. Regarding the kids, it's a great question. And, kids are the ones who are going to be telling the story of this. And I think that it's really important that we teach them resiliency. This isn't masking up an old year, but what ways, I had my kids sit down and write a list of all the ways that they were going to build resiliency this year. And what are the things that they always wanted to do and never were able to do? I'm like, you're in the house a lot. What have you always wanted to do? And, my oldest was like, I want to be a better bread maker. So we've been eating very well. And so, I think that our kids look to us on what we say about this. And if we're like, this is a challenge, we're going to figure this out, we're a really strong community, they're going to be like, sweet. And I get to wear a cool mask with it. If we make this a really awful, traumatic thing for them, they're going to respond to that too. They take our leads from us. And so I think we as adults, I find again and again with the schools, the kids are like, whatever, I'll bedazzle anything you want and I'll wear a pirate patch if you want me to. But it's the parents who are worked up about it. And I think if we just, really are finding ways to be active and healthy and mentally connected. And also, I think it is important to just keep recognizing kids are not super affected by this disease compared to adults. And so, a kid's not going to explode into COVID and die if their mask comes off for a second. Like they're going to probably be just fine. And so just like we teach them to wash their hands, we just teach them to kind of minimize the spread of this overall. And I think it's just finding a way to move forward together. But I also think it's pretty impactful if they lose their grandpa or if they lose their parent. And so we want to also not have that trauma of loss. And we've been very fortunate in this state to not have as much death from this disease as others. And I hope that at the end of this, we all say, man, we did too much. And we had all these kids who are healthy and well and learned resiliency, and we didn't have excess death. That would be awesome. But that future is yet to be written. So it will depend on what we do collectively.
Thank you. Just one more follow-up. A shout out to SVT. Took my granddaughter out of school today, went to the clinic. She'll get a quick test tomorrow. So there are tests available at SVT. So.
Sweet.
Yeah.
That's great.
Yeah.
That's the goal, right? Like you get that quick test and the kid gets better. They're asymptomatic for 24 hours. It's negative and back to school you go. I hope she feels well soon.
She's got the cold. COVID symptoms. Thank
All
you.
right. Well, this has been a good discussion. And Dr. Zink, I think you're probably in your 15th hour of the day here, and your family's probably wanting a little more of your time unless you've got 3 more meetings tonight. So we as a community really appreciate you taking the time to meet with us, listen to our questions and concerns. And I think the state of Alaska is lucky to have a leader like yourself out in front of this thing. So we all appreciate you taking the time.
Well, thank
Mr.
you.
Mayor,
Oops, sorry.
before you sign off, Dr. Zink, we do have one more hand raised. It looks like from Councilmember Kohlberg.
Yeah, this was if I heard it right, the borough won't accept a test out of Seldovia and the kid has to go to Homer. Did I hear that right?
No, any test will work. So they don't have to go, we'll accept an Abbott test, we'll accept a state test, we'll accept a Cepheid test. We want to make sure that you have testing in location and you can go wherever. The only test that we don't accept for school testing is a blood test, because that is an antibody test that shows a past infection, but doesn't show that you're actively infected. So that's the only one. And those are very limited. Most places don't have them, but that's the only type of test that's not included for schools. But no, we want you to get tested in location, not have to travel.
Oh, okay. That answers my question. Thank you.
Thanks for clarifying.
Okay, I think that wraps it up. So again, Dr. Zink, thank you so much for your time. And I'm sure we'll be talking to you again in the future.
Thank you so much.
Thank you all.
All right,
Have a
bye-bye.
great day. Bye.
You too.
Thank
Thank
you.
you.
Thank you, Dr. Zink.
You're welcome. Thank you.
Good night. Okay, thanks everyone for that discussion. I think that was very productive, good discussion. Let's see here, where are we at? Item H on the agenda, public presentation for items not on the agenda.
Yes,
Do you have
Mayor.
anyone from the public?
Yes, we do. We have a Miss Laurel Hiltz.
Okay,
Hey, Mr.
Laurel,
Mayor, can you
you're
hear
up.
me okay?
Yep, go ahead, you're up.
All right, thank you so much. So just a few community things that are coming up here. Certainly as we go into Halloween weekend and just understanding with a positive case in the community, everybody's going to make the decisions that are needed to be made to ensure that we can have a good time in a safe and healthy way. So one of those is, there'll be trunk or treat, and that's pretty contained way to go about it. But anyway, there's about 6 or 7 different vehicles that'll be set up at Main Street Market, and some candy over at SVT as well. And then I know that the chapel is doing a gathering. And again, I think that we'll trust that everyone's making good choices in regards to sanitizing and mitigation efforts, and just hope to have a really great Halloween. I think that there's a map maybe that Harmony has made, and we'll be looking for that hopefully here soon, that we can see of where there would be houses that you can trick or treat at. And that map's been generated or something like it in the last few years, just because we have a number of homes that are not year-round residences. And so, especially when you have new families, they don't know which houses to head to. So otherwise you can knock on every door and see what happens. So and then there's also the Seldovia Chamber of Commerce will be hosting a potluck, or excuse me, not a potluck, a cupcake reception for the Citizen of the Year. So to recognize Christine Brandon, that will be on Friday, November 6th at 7 p.m. at the Seldovia Conference Center at SVT. So again, that's a large space, lots of room to spread out, serving cupcakes only. And so it won't be a risk in terms of, everybody bringing all the food they made at home and bringing it together. So just trying to have a good way to safely recognize the efforts of Christine throughout the COVID pandemic and her engagement in our community. So I think those are the couple of things that are there. And just a note, I'll be working on a gathering for our veterans as we get closer to Veterans Day. Thank you.
Thank you, Laurel. Heidi, anyone else?
Not seeing any more hands raised, Mr. Mayor.
Okay, we'll move on down to committee and advisory board reports. I do not believe we have any tonight. And then next item is going to be agenda item J, but we're going to take a short 5-minute recess because we're at an hour and 15 in. I'm going to sign out and sign back in because this is about the time my bandwidth problems start. And we'll give everyone a quick bathroom break and then we'll get started again.
Hey, George, are you looking for me?
We're watching you talk to yourself, George. You're on mute, dear. You could pantomime
It's probably not all that rare an occurrence.
every day down the street. Heidi, there's all kinds of songs I think about. Am I blue? Am I blue?
It has to be the walls in this room, and I was going to be in my bedroom, but it just is there's too much activity that goes through there with the bathroom and the hallway downstairs. So I, at the very last minute, ran into this room and I just grabbed a couple of lamps, but even with them, it's just very blue.
See, Vivian's got there's a warm glow to that whole room. Oh yeah, Vivian, we're talking about Heidi's blue room.
Yeah.
Blue
Mhm. Yeah.
Heidi, I have a question for you before we get started.
What's that?
I see these forms that the air taxis are filling out in Homer when folks are coming this way about the COVID situation. That they take a series of some data from every passenger that gets on. My question is, do they do the same thing for people leaving town?
I don't know. I'll have to double check with them, but I believe it's for anybody who's flying. Actually, but I flew the other day and I didn't have to fill out a form.
No, they don't. I've flown both on K-Bay and Smoky Bay Air, and nobody's asking COVID questions at all.
Yeah.
Either direction?
No, there's no more COVID screening with the airlines at all. Nor with Macos.
I feel I got screened, but that was some time ago.
You're on a list, George. You're on a list.
Yeah, right. The black helicopters are coming, I'm sure.
No fly list.
Which is it? So it's just the first one, right?
I've been to the hospital, been to medical appointments over there at the specialty clinic. There's very little screening that takes place.
We're council work too.
Sorry. Harmony, did you have a quick comment before we went into the meeting? I see your hands raised.
I was just making sure that before we got started, if at any point I was going to participate, you could hear me. For some reason, the Zoom meeting here is different than the Zoom meeting that we participate in elsewhere. So
It's a webinar, which allows for different settings for your meeting. So it is a little bit different, but yes, if you do that raise hand option, then we can hear you. Or then we can allow you to speak. We allow it.
that's kind of what I figured. But again, I just want to make sure before things got started. Also, I'm a fan of the blue room and the turtleneck. So I'll go back to mute and wait until I have actually something to say.
Okay, thank you.
All right, Heidi, is it looking like looks like we got everybody on?
Yes, I believe so, Mr. Mayor.
All right, we're still recording, so we can get started here. All right, we're out of recess, back to order. We will start with item J2, Action Memorandum 21-03, confirming the appointment of Kathleen Gruber to the Soldovia Planning Commission. Staff.
Yes, thank you, Mr. Mayor. This came about because last year, or I should say, I believe it was in late 2018, Kathleen Gruber put in her letter of interest to be on the Planning Commission with the request that it was only for a one-year term. Her term has since come and gone, that 1 year, but she would like to continue on the Soldovia Planning Commission for the foreseeable future. So this is just reappointing her to that position and allowing her to continue in that seat if council wishes.
Okay, thank you. All right, we'll open it up for some council discussion.
Mr. Mayor?
Yep, go ahead, Vivian.
Yep. Oh, I am totally in favor of Kathleen Gruber staying on the Soldovia Planning Commission. Totally in favor of it, and I thank her for her time and coming forward.
Thank you, Vivian. Anyone else?
Yeah, Mr. Mayor, I totally, can I go?
Yeah, go ahead.
Oh, sorry. I agree with Vivian. Kathleen's already served. So I think it's great that she's willing to do it again, and I'm in full support. Thanks.
Okay, thank you. Anyone else?
Mr. Mayor?
Yep,
Mr.
go ahead,
Mayor?
John.
Yeah, I agree. I'm in favor of Kathleen. She's stepping up to the plate. I'm definitely in favor of her. Thank you.
Okay, thank you, John. Anyone else? Okay. At this time, we'll go ahead and open it up to anyone, any comments from the public? Heidi, I'll open that up to you if you've got anything.
Mayor Campbell, I'm not seeing any at this time.
Okay. All right, we'll bring that back to the council then. And council, what are your wishes?
Yeah, I'd like, Mr. Mayor? Oh, sorry.
Yep. Go ahead, Vivian.
Oh, I was just going to say that I will make a motion that we appoint Kathleen Gruber to the Soldovia Planning Commission in Memorandum 21-03.
Second.
Okay, we have a motion and it is seconded to appoint Kathleen Gruber to the Soldovia Planning Commission. All those in favor, Sweat,
Aye.
Goldberg,
Aye.
Morrison, Rojas,
Aye.
Nathan.
Aye.
Motion passes unanimously. Kathleen Gruber is reappointed to the Soldovia Planning Commission. Move on to the next item, item J3, Action Memorandum 21-04, appointing blank to the vacant city council seat. Presentation by staff. Go ahead, Heidi.
Thank you, Mr. Mayor. This is in the laydown, pages 3 through 5, the action memorandum with 2 letters of interest that follow, one from Dean Lint and one from Harmony Payton. They both are qualified to fill the seat, and we'll leave it up to council to appoint somebody through action memorandum if you so choose.
Okay, thank you, Heidi. This time we'll go ahead and open it up for council discussion.
Mr. Mayor, if I may?
Yep, go ahead, Vivian.
Yeah, if I could just clarify, Heidi, this is for 1 year. It's finishing out. Is that correct? Or correct me?
Correct. Yeah. So with a vacancy, they would fill a seat until the next elections, and then that seat will be open for a 2-year term so that they can continue with the 3 years, the 3-year cycle.
Right. Well, I think it's wonderful. We actually have 2 applicants. And personally, I would love to see, my goal is to get our young people, another generation coming in to council. So I would appoint Harmony Payton. I think it's great that she would like to step forward, get some young blood on the council. I think it's really important for us to move forward. Thank you, Mr. Mayor.
Thank you, Vivian. Anyone else?
Yeah, Mr. Mayor.
Yeah, I think George had his hand up first. Go ahead, George.
I was just gonna say, I had encouraged Harmony to apply for this position for some of the same reasons that Vivian has pointed out. So a young person without an attachment to any segment or faction in the town. She's a bright young lady, and I think she would do a very good job on our council. And I'd like to see us again have some new blood and give other folks a chance to serve here. Thank you.
Thank you, George. Bobby, go ahead.
Yeah, and I concur with that. We've been talking about it for a while, that we'd like to see some younger folks take a little bit more active part in the community. I think it's great that Harmony's willing to step up. She's certainly invested in the community, and she has my full support. Thanks.
Thank you, Bobby. Anyone else on council? Okay, this time we'll go ahead and open it up to the public. And Heidi, you'll have to let us know there.
Mr. Mayor, I'm not seeing any hands raised from the public at this time.
Got one here in the council chamber from the public.
Yep, I see Dean's got his hand up. Go ahead, Mr. Lent.
I agree. I think it'd be good to get somebody new and young on the council. I agree with what the council members have said. Thank you.
Thank you, Mr. Lent. Okay, there's no one else. Okay, at this time, we'll go ahead and bring it back to the council for final action or disposition.
Okay, Mr. Mayor.
Yes, go ahead.
Yeah, I'll make a motion to accept the action memorandum to appoint Harmony Payton for the remaining council opening until the next, for 1 year, for the 1 year.
Okay, do we have a second?
I'll second that.
Okay, we have a motion to accept action memorandum 21-04, appointing Harmony Payton to the vacant city council seat for the period of 1 year until the next election. All those in favor, Sweat,
Aye.
Kohlberg,
Aye.
Morrison,
Yes.
Rojas,
Aye.
Nathan.
Aye.
Okay, motion passes unanimously. Harmony Payton will be our next city council member to fill the vacancy. And Harmony, if you're on the line and can hear us, congratulations. At the same time, Mr. Lent, I want to thank you for your support and again for your previous service. I think this is important to listen to what the council has to say here in terms of getting, so we've all talked about this over a number of years, about getting younger members of the community that are invested, live here, work here, and make decisions to get them involved in local government. And I think it's critical that we all, as the years go on, we continue to pound the pavement and recruit younger members. It's an uncomfortable thing, and sometimes people are way out of their comfort zone doing stuff like this, but we got to get them involved. So it's not easy, but once you get their foot in the door, it takes a little time, and then they'll be in. So appreciate the discussion, and again, Harmony Welcome. So, all right. Well, that's good. We've got that filled. Item J4, Resolution 21-12, Water and Sewer Utility Relief Program. Heidi.
Yes, thank you, Mr. Mayor. So previously we had discussed and actually introduced an ordinance that would extend the utility relief to the residential customers of the city of Segovia. We passed, or the city council passed a non-code ordinance amending that fee schedule earlier this year that it gave a 50% water or 50% reduction of water and sewer utility rates to all commercial rate customers. That was the base rate commercial, small commercial, and large commercial. And with part of our agreement with the borough funding from KPB's CARES funding, we had discussed that part of that would be utilized to continue with that reduction for those businesses. And speaking in the office, we were trying to figure out how we could also offer assistance to the rest of the community or the rest of the residents, and not just the business customers for our area. And part of that came out is there are housing grants being offered in other communities. However, our community is smaller with not as many people that would be able to accept that kind of a relief. So trying to think in broader terms on how to get that relief, the most relief out to the community. There was this thought to carry on that 50% water and sewer billing rate reduction to also the residential customers in the area. But after reviewing that with our previous city manager and looking more into the logistics, we realized we were a little quick to the punch. And that doing it through a non-code ordinance that amended our fee schedule would not follow through with our CARES funding guidance, how we spend our CARES funding. So going back to the drawing board a little bit, looking at other communities in our area that have offered this type of assistance. Jan reached out to Soldotna, which I was really thankful for. They've run a successful utility assistance program. And just looking back over those guidelines to realize the pieces that we were missing was, one, that we needed to have the justification of why somebody would need that assistance, meaning we can't just offer it to people or we can't just give it to people. We have to have that justification in place. And that's the application that's in the packet. It's a 1 page. They certify that, yes, they need this. Yes, they've been hurt by COVID and what months they want it for. It's from September through December, and we can retroactively add that credit to their account. So that's the second piece, is that we can't use CARES funding for things that are allocated in our budget already. That revenue from the utility services is in our budget. However, by adding it as a credit to the customer's account instead of changing the billing rates, our revenue stream stays the same, and we're just pulling the funds from the CARES fund for that direct impact to the customer, not to the city, which is the difference there between a fee schedule change versus just a grant program. That's what this would be is a grant assistance. People apply for it. They get the assistance. We directly apply it to their account, and for those months that they list, if there's any changes to their circumstances, they no longer need assistance on those customers. It's their due diligence to reach back out to the city and say that they no longer need that assistance and we can take it off. With that being said, we think this will be a beneficial program to everybody, and I really hope that should council pass it, that everybody applies for it. There are a few people that won't qualify, mainly public entities that are already receiving assistance or offering assistance. But otherwise, everybody, residential, commercial, even houses of worship and Seldovia Village Tribe would be able to apply, and that's for September through December.
Okay, thank you, Heidi. This time we'll open it up for council discussion.
Mr. Mayor, if I may?
Yeah, go ahead, Vivian.
Yeah, I think this is a great thing, and I'm glad we picked up the pieces and kind of restructured it, that it works best for us and for the community. And for those, I would also encourage those who have financial impact from COVID to go ahead and apply. I think this is a good cause to help people in the community get by, and I'm in full support. Thank you.
Thank you, Vivian. Anyone else from council?
Yeah, Mr. Mayor.
Yep, go ahead.
Yeah, I agree with Vivian. I think it's a good thing that we're able to do this, and I encourage everybody to apply for it. Hopefully it'll just help, you know, a little bit in the now. So I'm definitely going to support this. Thank you.
Okay, thank you. Anyone else on council? Okay, hearing no further comments, we'll open it up to the public. Heidi, you'll have to let us know.
Yes, Mr. Mayor, I am seeing one hand raised from a Miss Laurel Hiltz.
Okay, go ahead, Laurel.
Yes, just want to say thank you to the city staff for exploring that and being able to involve and include the houses of worship. That's a great thing for the churches in the community that are serving the community on a regular basis. And it's just a really nice thing that that's able to be included, and certainly as well for Seldovia Village Tribe. So thank you very much.
Thank you, Laurel. Anyone else, Heidi?
Not seeing any at this time, Mr. Mayor.
Okay, seeing no more public comments, then we will take it back to council for final action disposition.
Mr. Mayor.
Yep, go ahead, Vivian.
Yep, I would like to make a motion that we accept resolution 21-12.
Is there a
I
second?
second it.
All right, motion is seconded. All those in favor? Sweat,
Aye.
Colberg,
Aye.
Morrison,
Aye.
Rojas,
Aye.
Nathan.
Aye.
Motion passes unanimously to accept resolution 21-12, which is the water and sewer utility relief program. Okay, moving on. Item K, unfinished business, none. Item L, new business, consideration of placement of small business, economic development, rental buildings, vacating the right of way. We're in legal. Presentation by staff. Go ahead, Heidi.
Yes, thank you, Mr. Mayor. So per the council's request, I did reach out to legal after the last council meeting. They are currently doing research and have not got back to us yet. There's still a little few pieces to follow up on. So at this time, I would ask for council to consider the possibility of postponing this discussion until we have that information gathered for you.
Yeah, did they give you any indication at all? Is it possible we might have it in a couple weeks for the next meeting?
I have not heard a specific date, but I did reach back out to Joe, and I'll reach out again tomorrow first thing and call and see if I can get that date and send that to you guys.
Okay, sounds good. Council, what are your wishes here?
Mr. Mayor.
Yep, go ahead, Vivian.
Yep, I would agree that we need to wait and move it forward in a couple of weeks, and hopefully we'll have a decision of some information that we can work on. Thank you.
Okay. Any other comments?
Mayor,
Early got your hand up.
Mr.
Yep,
Mayor.
go ahead.
Yeah,
Go ahead, Burley.
I still don't think we ought to even think about vacating that right of way. It's, there's gonna come a time when we're gonna need our right of ways to get to that coast. I think it'd be a shame to vacate it. It's, pretty strategic spot. And I just don't see the reason we need to crowd them buildings up against that pavilion. So, thank you.
Okay, any additional comments? Okay, Heidi, we'll go to the public. Anyone from the public?
Yeah,
I see Mr. Lent has his hand up.
I was
Go ahead, Dean.
wondering if Heidi found out what's involved in vacating that street. Yeah. Okay, she hasn't found out yet.
Yeah, I'm having a hard time hearing. Were you asking if she was finding out what was involved in vacating it?
Has Heidi found any information yet?
Okay.
That's why we put this off for 2 weeks. That's why we put this off for.
Okay. Okay, that's good.
Okay, Heidi, any other hands up from the public?
Not that I'm seeing at this time, Mr. Mayor.
Okay, that'll bring it back to council for action disposition, and we will need a motion to postpone if we're going to go that direction.
Mr.
I'll
Mayor?
make a motion that we,
Okay.
yeah, I'll
Yeah,
make
go
a
ahead,
motion
John.
that I'll make a motion that we postpone consideration of placement of an economic development rental buildings until we've heard back from legal.
I'll second that.
Okay, we have a motion to postpone that has been seconded. All those in favor, Sweat,
Aye.
Goldberg,
Aye.
Morrison,
Aye.
Rojas,
Aye.
Nathan.
Hey,
Motion carries, and that motion was again to postpone until we have word back from legal for the placement, for the information, for the vacation of the right-of-ways. Okay, we'll move on to item M, Treasurer's Report. Okay, so I saw that there's something in the packet, but are we gonna have a report tonight, Heidi, or no?
Yes, there is a treasurer's report in the laydown, and Jan is on the line if you'd like to have her speak to that. She's can give you a brief rundown. This is her first one, so bear with her, but I'm sure she'll do an excellent job.
Perfect. Jan, go ahead.
Hi, thank you, Mr. Mayor and Council, and thank you for your patience as I learn this process. Yeah, you can see in the laydown the different spreadsheets and so on for all the different accounts, and then there should be a 2-page overall financial report that gives you kind of a snapshot of where we're at. I should pause and ask if you can hear me okay?
Yes.
Okay, and I apologize
Yes.
for the no video. We are kind of in a low light situation here, so I'm not even going to try the camera. But as you can see, our general fund revenues, we are at 63% of projected revenues, even though we're only, about 25% into the year. A large portion of that is because the revenue sharing was received in July. I believe that was $75,000. And then you can also see where we're at in terms of the revenue earned on the AMLIP fund. And then in general, as we look at our expenditures, as we look across the different accounts, we're at about 29% of our expenditures, which is right about where we expect to be, since we're right about 25% of the way through the year, a little bit more. The main budget that is over is the parks budget. A lot of that was because of we having an extra employee in the parks department this summer. That obviously was a time limited thing. So we expect that that parks budget is going to even out as we go through the winter, and we'll get more on target at where we expect it to be. We did have a couple large expenses in public works. We did some patch paving on Main Street. And then the grader required some tires that were rather expensive. And then obviously we had the hazardous waste removal fees that happen this time every year. And so if you do look at September, we have kind of a large blip for public works, and that's the reason for that. Some of that patch paving expense is actually recoverable. We haven't recovered it yet, but we anticipate that we will. In terms of the special revenue funds, again, the water and sewer are about where we expect them to be this time of year. The dock is a bit ahead, which is great. We just got some payments in from Marine Highway Service. The harbor is obviously at 12%. It's a bit behind, but a big part of the reason for that, is I'm sure you probably are more familiar than I am, is just because the annual mortgage fees that make up a large part of that revenue, those don't go out until March, and come in between March and May. And so obviously we're not seeing a lot of people renting slips here in the latter part of the summer and early fall. The other kind of anomaly there with the harbor is we paid the bills for the retail buildings and the buildings as well as the freight. And so at least for now, those have been allocated to the harbor. That may not be the best spot for those expenses. That's something I'd like to discuss with the new city manager as to where we want to allocate those. But that's why there's such a blip right there. And that's kind of the quick summary. If you have any particular questions, I'd be happy to do my best to answer them.
Thank you, Jan. Appreciate that. Council, any questions?
Mr. Mayor?
Yep, go ahead, Vivian.
Yep. I just need a second. I wish I would have taken a note. I had a question in the spreadsheet, but Jan, you did a great job with your overall summary. But there was something in the spreadsheet that caught my eye, and I was trying to figure out. So if you want to talk about, if you want to go through the spreadsheets at just a general overall synopsis, and I'll look for what it was that was red flagging me, perhaps, if the mayor wishes.
Yeah, that's fine. Go, Jan, did you want to just expand a little bit on those?
Sure. You wanted me to just go tab by tab, or?
Yeah, that's fine. You can just start from the top there. Page
Okay,
8.
and I'm a little bit limited because on my small screen, I can't see much of any of the spreadsheets at one time without scrolling around quite a bit. But we can start just by just looking at the general fund revenues. As you can see, property tax, and again, this is me being new. I don't have having not seen a year cycle yet, I don't have a real good handle on how things play out throughout the year. But as you can see, most of our revenue is coming in through the real property tax. Personal property tax is pretty minor. You can see just a huge drop in the sales tax revenue in September compared to July and August. And obviously we expect some drop then, but this year was definitely pretty dramatic. And so that's something that we're going to have to look at going forward. Obviously through the winter, we expect those numbers to be down, and this year down more than normal. So we look at administrative expenses. Had a little bit of anomalies with some of the wages and salaries. And I said administrative expenses, but this is actually will carry through across because of the way we allocate out. But because we had two fairly high salaried employees depart, within a span of 6 weeks, and both of whom had fairly significant amounts of vacation and so on accumulate that they were then paid out for. We did have some kind of a higher blip in some of those expenses that obviously now with those positions open for a bit, we're kind of recouping that a little bit. It's not how we want to recoup expenses, but I guess there is a little bit of a silver lining. Let's see. Obviously, any of the COVID-19 related expenses are not captured in this spreadsheet because those are, those are not coming out of the general funds and so on. Those are coming out of grant funds that are not here. So anything related to those shouldn't be captured within any of this. One thing that we are continuing to work on, you will notice that Cassell software fee that was not budgeted for, and that shows up basically everywhere because we are still having to pay that. We are working on a solution for that, but that is an expense of about $1,200 a month that we are trying to get past. It's proving to be a bit of a challenge. It's probably going to take quite a bit of staff time because the challenge that we run into is that we are required to maintain those records for a certain number of years, but without access to the Cassell software, we can't access the records that are contained within it. And so we're looking for an efficient way to export those records. And with just it being as short-staffed as we are, that's been a challenge that we haven't been able to meet yet. And so that's why you'll see that number going through all the different accounts. Let's see. I'm just kind of paging through here and seeing what else kind of catches my eye. I don't have my Zoom visible right now, so please feel free to speak up if there's something in particular you have a question about.
If I may, Mr. Mayor, I found one question I had.
Yeah, go ahead, Vivian.
Jan, in the police department expenses, and probably this is a simple one, underneath wages and salaries for September, was that taking care of payroll for August?
Let me
and
just
it was
scroll
double
to that.
Yeah, because the previous months, one was about 1,800, August was 1,900, September was 3,246.
That is exactly what that is. That is that September payroll that's capturing not only his last 2 weeks of employment, but it's also capturing all his vacation pay and all that. So that's why that number is so high.
Okay, thank you.
Mm-hmm.
Yeah, Jan, I've got a quick question for you too on the, just back to your comment about the Cassell data and the, that $1,200 a month expense. Have you guys thought about just looking into a third party to see how, I mean, a couple months of that, of those fees, we might be able to get a third party to extract that data, quickly so we can get out. I assume they'll allow us to get out of that fee as long as we can prove that we can get access to or have access to those records. Is that the case?
Right. So I talked with Cassidy actually a little bit about this last week, and basically I've talked with our IT crew a little bit about it. They didn't have any good answers. It's not, unfortunately, it's not something that we can just export to an Excel spreadsheet or anything. And Cassidy and I basically came up with pretty much what we might have to do is just come up with every potential report that we anticipate we might need and then run those reports and save them as PDFs. And so as you can imagine, that's quite a lift. And so that might be hiring someone for a special project to do that. I'm not sure what the best way in is. And unfortunately, Cassell is, the reason that we moved away from it, or part of the reason we moved away from it, was because it's just not particularly user friendly. And so it would involve a bit of time, if we potentially involve a bit of time teaching someone to use the software, unless we were able to find someone that already had a bit of familiarity. So it is definitely something we're aware of and definitely something we want to get done. But again, we've just, with being shorthanded and so on, it's been a challenge.
Gotcha. Yep. No, understandable. All right. Thank you for that. Any other questions? Council?
Yeah, Mr. Mayor, I have a question for Jan.
Yep.
Let me
go
just
ahead.
Yeah, sorry, let me find my, oh, okay, Jan, so, I forgot already. Do we also pay for a monthly fee for QuickBooks?
QuickBooks does have some monthly fees associated with it, but they're more in line of things, like paying for the internet access that ties the credit card fees, that type of thing. So QuickBooks is a much less expensive program also than Cassell, and yeah, it doesn't have that huge monthly fee.
Okay, and so, and the reason we're still paying for Cassell is because there's some, I guess I'm not quite understanding. If you could explain it to me again. It's certain papers
there's
that
about,
we have to keep.
right, there's a, Heidi knows the retention schedule better than I do, but there's about 2 years worth of data, of financial data. And Heidi, please correct me if I misspeak to this, that's within the Cassell program. And if we don't continue to pay that fee to be able to use the program, we lose our ready access to that data. And if we did that, we would be out of compliance with the retention schedule. And we do, we still run into times when we need to go back into those records. And so what we need to do is find some way to get that data out of Cassell so that we don't have to continue. It's basically like,
they're basically holding us hostage.
Locked in a room, and Cassell is the key that lets us into the room.
Yeah. Yeah, okay. Well, that doesn't sound very nice of them, but you'd think they would somehow incorporate that for everything you pay on a monthly basis, throughout the year. They would include that when you exit the program, but obviously not. So, okay, thanks.
It's obviously designed on purpose.
Yeah, Mr. Mayor, if I may.
Yeah, go ahead, Vivian.
Yeah, Jan, just to clarify on the public works expenses, we had a pretty big uptick in wages, salaries for September, October. Was that overtime or is that again? We went from 4,000 in July, but now we're 6,000 and then 7,000, 7,600.
Right.
What's
and yeah,
that about?
Yeah, I noticed that too. And honestly, I haven't had time to dig into every blip that picked up. So I don't have a real good answer for that. I can tell you that some of that, at least in September, some of that is going to be a bit of Cassidy's wages because they're allocated again across all the different accounts. And so paying her out for her vacation and time is part of that blip. I don't have a real good answer for September and October, especially October. And that is something that I'm going to dig into and find out. Go back in and see why those numbers are where they are.
Okay, and that outside labor services at 11,750 in September, was that or digging up what was that?
That is the patch paving that was done along Main Street area. And
what
that's about a little over $2,000 of that will be recoverable, but we haven't recovered it yet. So that'll actually be around 9,000 in actual costs.
Cost to the city.
Mm-hmm.
Okay. All right. So the rest, so that's with businesses helping out or whatever entity was responsible with the other.
There was one other private entity that received some of that paving service. And so we paid the overall bill and then billed out that portion to that business. And so that will come back to us.
Okay. All right. Thank you.
Yeah, Jay, I had one more quick question here on the sales tax revenue. So you guys have, it shows back to that first page on the general fund revenues. So it shows sales tax for July, August, and September, but I'm not sure how you guys allocate that. But so July, August, and September's return is actually going to be filed here in a couple days. So you'd have 30 days after the end. So I'm just curious as how we have revenue already in there for those months.
Those basically reflect the numbers given us from the borough. And that's another area where I am not well enough versed yet to answer your question very satisfactorily. But, every month we get a check from the borough with all the different taxes broken out, and that's basically reflecting the spreadsheet that we get from United Peninsula Borough. And I hope to learn more
Okay.
about how those
Yeah,
numbers come about.
Okay, yeah, that one I would check into because I don't know how I don't know what the inner workings are, but I know we have, no one's filed that yet. So you file those quarterly, and then, yeah, that one would be getting filed here pretty quick here. It's due by November 1st, so, or October 31st.
Right.
Okay, nope, thank you.
Nope,
Thank you for that.
that is definitely
So,
on my
any other
homework list.
questions? Yeah, appreciate that. George, did you have your hand up?
I'm just scratching.
Okay. All right. Well, if there's no other questions, Jan, thank you. Thank you for the information. We appreciate it. And yeah, we'll get these streamlined as we move forward. So thank you for your presentation tonight.
Thank you, Jan.
Let's see, M2 City Manager's Report. Heidi, go ahead.
Thank you, Mr. Mayor. And I would like to say just real quickly that if I remember correctly, there are people that do file monthly, and that's part of it. We do receive monthly payments from the borough, and they're a lot smaller of a check every month, and then we will receive a big quarter from the people that file quarterly. But there are people, because of their business situations, that file more frequently.
Okay. All right. No, appreciate that. That might explain that, obviously.
Yes, and then so with the city manager's report, I'll make it quick because I know we do have somebody waiting on the other line for us, but let me pull us up here real quick. I'm looking, so City of Seldovia COVID Management Mitigation Coordination, we just had a great discussion with Dr. Zink. Cases are on the rise. There was the press release put out today that is in your packet following the city manager report. Along with that, also, I just wanted to make council aware that Susan B. English School has shifted to remote learning for the rest of this week. And we hope to hear at the end of the week what their plan is for next week. But knowing that the community's kids for the next 2 days are home, and then it's parent teacher conferences the weekend, which of course includes Halloween. And then we'll find out more Monday if they'll be able to return or not. And I'll keep you guys up to date on that. With that, masks for the public. Layla has an amazing contact from Fairbanks, and oh my goodness, I'm sorry, Layla, I just forgot her name. So you'll have to remind us, but there was a lady, a contact in Fairbanks who really wanted to make masks for the community, and she made over 400 masks and mailed them. So we have over 400 handmade cloth masks that Layla has been working to bag and get ready to distribute to the public. And we're going to have a big campaign. I'm hoping starting tomorrow morning, that if people do need cloth masks, they can come in, they can get them. They're all different sizes, from little children up to adults. And I do believe that Layla also dropped some off at the school to distribute. So they will be going out into the community. CARES funding, the city has received the second round of funding from the state, so that's exciting. We had to expend 80% of the first round in order to get the second round. Well, we believe we're at about 75% of expending both rounds, because we have to spend 80% of both in order to get the third one. And these two are much smaller. They're like that $32,000, $31,000 payment. So we've received that second round and are looking forward to receiving the third round. Part of that is the Small Business Grant Relief Program, round 2. That closed on Friday. We did have a number of applications. We have not had a chance to review it. It just closed Friday at 4. But I would like to ask our review committee, that was John and Bobby, I believe. Is that right? Did I get that right? If you guys are interested in maybe coming in, if Friday afternoon would work. We have interviews on Thursday and Wednesday. The new CM is visiting, but if you guys were available either Friday morning or afternoon, it'd be great to get to go together and start reviewing those applications so we can get another round of money out. Just let me know what works best for you. CARES Act expense tracking. It was really fantastic to see that City of Seldovia spending summary, and that's something that we want to continue going forward in the future. So hopefully we'll have an update with that at the next council meeting or a couple council meetings. So you guys can keep apprised of how those spendings or how the spending's going through the end of the year. Professional service agreement, Cassidy Cameron helped facilitate the new police hire and is continuing to work with Jan. So we're thankful for her assistance and being able to kind of help carry through with the transition to the new city manager. That's the exciting news is police position hire. We had our new police chief came to visit last weekend with his family, and through negotiation with Layla and Cassidy, he's accepted the position. I think they're still working just to finalize that paperwork, and he's going to sign off on that, but he is planning on being back up here and starting November 1st. So he's coming, he's on board, and we're excited to have him. I'll hopefully put out a little post about him with a picture of him, letting the community know he's around, and I'm sure everybody will see him driving and at the office. So that's exciting. FY20 audit, we're still awaiting. I know it was a big task for them, and they've also had a lot of other work since a lot of things that they normally audit in the spring was pushed back due to COVID. So I just need to touch base and see where they're at with that. Wastewater sewer lift station repairs. We actually switched suppliers. We were with Alaska Pump and Supply, and we found out that they were actually more of the middleman. So with that information, we contacted Alaska Rotec and who they'd be purchasing through, and that brought the cost down by a little bit by just going straight to the supplier. And they have some really good options for us. It's really exciting. We're still working with Kevin and VSW, and Jan sent in the grant request today. So fingers crossed, we hear good things. We were able to include the pumps for the sewer lift station by Inside Beach and also the one by the boardwalk. So hopefully we will get those all caught up with the pumps that they need. We'll be on a service rotation. If we're able to get that grant and get the correct amount of pumps, then we'll always have 2 in service and then 1 on the shelf, and we can cycle them through yearly and service them yearly, which is what we're supposed to do. With that, we're also having some sewer work on Rocky Street. I don't know if you guys have seen John out there, but he's been out there with the jetty for a couple of times these past couple weeks. And we're continuing just to work with the homeowners in the area. We're not sure what the issue is at this point. Flushing through the system seems to be helping. It alleviates the problem for a few days, and then it comes back. So we'll continue to communicate with them and see how we can assist and make sure that at least on our end, our system is running the way it should be. Public Works hire interviews are scheduled for later on this week, Thursday. So we have some excellent applicants that we are looking to, and we're excited to move forward with that position. Tsunami warning. The city participated in you guys know there was a tsunami warning on Monday. After that tsunami warning, we participated with the Borough National Weather Service and Tsunami Warning Center. The borough invited the key players for that warning system into a meeting with the rest of the communities, just to talk about should the warning have gone off for our area, what the overlap is in the mapping, why our area was included, how that left the communities to play it safe. Even Seward, for instance, in the beginning, when that tsunami warning goes off, it goes off for the entire borough. So even Seward was included. The borough was able to quickly communicate, no, Seward shouldn't be included. They were taken off. Those warnings ceased in their area, but still continued in our area. And with that, as a city policy procedure, the warnings go off, we're going to follow suit. We're going to do what we're supposed to do. We moved equipment. We were in constant contact with the borough. We were following state notices and tsunami warning notices. And we were, just trying to keep abreast with all the information that we were receiving, knowing that there was a potential that it wasn't going to affect our area, but that we still needed to follow through in case it did. And, you know, thank goodness it all worked out. Everything was fine. They are working on that mapping, refine it a little bit. And more than that, also working on the automatic messaging that comes through those sirens. The borough's been working to adjust those text messages. The all clear, for instance, is not an automatic message at this point. That's why we got the all clear. And then the tsunami warning went off right immediately after we'd given everybody the all clear. KPB alert sent out the all clear, and then the sirens went. And so they're working on streamlining that process a little bit. And it was really a great conversation to have all the key players in place at one time. City manager hire, we have been in discussion with Ms. Friedlander since the last meeting, and she is coming for a visit this week. She'll be doing an overnight and would like to meet with some of the staff and council on that Wednesday. So we'll be getting a hold of you guys to see what we can set up and to be able to continue to proceed with negotiations. We had a meeting with SVT, hosted a meeting with Representative Stutes and Senator Stevens on Friday that Mayor Campbell, Councilmember Sweat, myself, and other members of the community were able to attend. It was a fantastic meeting. It was really great to hear from them again about the Alaska State budget and AMHS reshaping work group. With that below, the AMHS reshaping work group final report was included in the regular packet for this meeting. And I was working in discussion with Mayor Campbell on a letter to DOT and our legislators about how important this service is to us here in Seldovia, and what a issue it is for our community when we lose just one service, with how limited it is that we see that ferry. The loss of this ferry service at the end of October was just really heartbreaking for a lot of people in the community. There was revenue loss, some projects that were not able to be completed, supplies that were not able to be sent. We're really hearing it, how much it really impacted the community. And I was working on a letter to express that. And then after hearing from our representative and our senator, just that talk about that reshaping work group, that report and what came out of it, and ways that we can really help things in the future. I wrote down some keywords, about needing forward funding, needing a new governance, like the reshaping work group to overlook the board instead of having DOT, because they have so much that they're covering. We're looking for service sustainability and being able to support the replacement of the Tustamina, which was not in the work group, or not in the final report. So knowing that there's all this key jargon, these key elements that we're looking for, I was hoping to reach out to the council and put it through to you guys as a resolution at the next meeting, and having that resolution go to the governor, have it go to the legislators, have it go to the state, having that really strong voice from you guys about how important this is, and how, that they need to really consider when that there is a service loss, or even if it's just one trip, what it means. And if we can be on a routine or a maintenance schedule, that they'll make up those days, or even just extend our timing throughout the year, how much of a difference that'll make. So with your guys' permission, I'll work on a resolution and bring it back at the next council meeting, because I think that'll be important for them to hear from everybody. General elections, last thing, is still in-person voting is happening at the city hall. We are getting voters every day. I feel bad because I haven't been there, but Diane and Jan have been handling it really well. So we are sending out ballots daily to the state. And if anybody wants to vote absentee and not in person, and not at the polls on November 3rd, you're welcome to come into City Hall Monday through Friday, 8 a.m. to 5 p.m. and we will certainly help accommodate that voting. And that's it.
Thank you, Heidi. Lots of information. Any questions from council? George, go ahead.
Heidi, during your tsunami meeting, was there any talk about somehow encouraging the broadcast radio stations to put out information that they have? Every single time we've had a tsunami warning, they tell you, tune into your broadcast radio station. I've never heard anybody say a word on broadcast radio. What can we do to encourage those folks to participate in this system? They're supposed to be part of it.
Speak to that, real quick, Mr. Mayor. So that message actually was brought up, and I do believe it'll stay in the works. They're going to add to it to begin the message with seek higher ground is how they're going to start it. They're going to change it a little bit, but still that to be able to turn to your local broadcast radio station. And maybe what we need to work on in our education campaign for emergencies in our area is that KBBI is our broadcast radio station. So if you're turning to any other radio station, you're probably not getting the information that you need, even on, television. I tried that, not this time, but the time before. I turned on the television, switched to all the news stations. It wasn't running. I wasn't seeing what I needed, but KBBI does follow through, and they do the reporting for the tsunami warnings for our area. And some, they play music in between, so sometimes you have to listen for a few minutes, but they will do the broadcast on that station.
Yeah, and just to comment on that, KBBI has also got a phone app as well for all the different phones. I actually just put it on my phone here last week because of what just happened here with the lack of alerts. Like even the alerts that go out, and I don't know who sends them, but it's the general alert that goes out and causes your iPhone, well, in my case, an iPhone to make the big humming sound, and then it's a general emergency information alert, talks about a tsunami warning. Well, my Verizon phone never got one, but my AT&T phone my work phone in Anchorage did get one. I could hear them popping off all over the building. So I think it was real random who ended up getting those messages on their phones. So, and that's part of the emergency warning broadcast system. That has nothing to do with apps or anything like that. But yeah, my Verizon phone never did get it. So, all right. Any other questions? Bobby, you had a question?
Well, I was just gonna say KBBI was pretty good, I thought, this time. Unfortunately, they're delayed on some of their broadcasts. And the announcer did say that, because I was specifically listening for if and when some of the tsunamis hit the different towns. And I was watching the clock because I was just curious, and the time would be passed and they didn't announce that they had one. And then the announcer would come on and say, well, they hadn't gotten that information yet. So, I'm sure lots of things aren't perfect, but it was pretty good.
Right.
So,
Yeah, I would say, I would say that, Heidi, I think we do need to notify the community. Not everybody knows about KBBI 890, but they are the ones that broadcast. And right, they did say, I think they feel a little bit bad even before the last one, where they were getting reports from the national level. And until they got the official report, they could not report that it had not hit Kodiak or whatever the deal was, that there was no tsunami. But I think it's a good thing if we educate the community. KBBI 890 is your channel to go to AM. So everybody knows. Thank you.
Thank you, Vivian. Any other comments?
Mr. Mayor, I do see one from the community from Miss Laurel Hiltz.
Yep, go ahead, Laurel.
Hi, Mr. Mayor. Yes, in relation to the tsunami warning. So one of the big things, and I apologize, Heidi, if you expressed this and I missed it, but one of the big things that was communicated by the National Weather Service was that they have a zone that their message goes out to, which is a different zone than a different agency uses. And so when the tsunami warning was expressed, it covered up to the Kennedy entrance, which is south of Kachemak Bay. But when the National Weather Service pushed out their message, it overlaps. And so they are going to work on adjusting that overlap so that this warning's not going out in an undue manner. And again, we're adding coals on the fire of people who are already greatly stressed and concerned about life in general. And so I would say, I would encourage that even if the city has to, I don't know if the city is mandated to say you must evacuate. I would look into that. And does the city have the ability or the freedom to explore a little bit and make a decision, even though the siren's going off, to make a decision to encourage community members to wait in this situation where it's hours away and wait for the buoy markers and the actual in-person eyewitness testimonies. So you look at Brett's report, you look at the earthquake gap, you look at the tsunami reports, you take all of that in before you get into your car and you drive up to the school and you have that added stress. So that would just be my thing, that the city not go immediately into the mode of evacuate if there's the ability to apply a lens of wisdom at it without having to automatically default to evacuation. Thank you.
Thank you, Laurel. Yeah, Heidi, anyone else?
I'm not seeing any more hands raised at this time, Mr. Mayor.
Okay, I appreciate your report. Very detailed, lots of information. And again, thank you. We'll move on down. Item 3, Chief of Police report, none. Harbor Master's report, that's also in the laydown on page 33. Leila, did you want to add any additional comments to your report?
I don't think so. We're just kind of holding our head above water at this point.
Okay.
A lot of this one crosses over into the city manager's report. No, I think we're pretty good. Thank you.
Council, do you have any questions on the Harbor Master report? All right, I just have one. I noticed you've got the emergency generator running for the multi-purpose building. Has that not been running for a while, or what was going on with that one?
No, so that one actually hasn't been running for years. And we had Glenn come over, which is the electrician, take a look at it. Got it up and running. And so if we were to lose power, we could start that generator for this building at any given time. One of the other things that we are looking at is if we're running on that generator, being able to open the bay doors for the fire department on that generator. There's still a few things that Glenn is looking into having that option. So as of today, it could run.
Okay, well, that's good news. Yeah, it's nice to see some of these projects, the infrastructure projects and some of our aging stuff, actually our equipment starting to get serviced and worked on. I think it's going to be incumbent going forward that we start taking care of some of this stuff and getting on things on a regular service schedule, like our sewer pumps and stuff. So yeah, we're getting to that point where we can't afford to wait for this stuff to break, and then we got to come up with a bunch of money at one time. So all right, any additional comments or questions on the Harbor Master's report? All right, thank you, Leila. We'll move on. Let's see, we had the Public Works report. That's also in the laydown on page 35. And everyone knows we're obviously down to, we lost Charles and we're just down to John Kennedy now. So yeah, hopefully we can get that, the new position filled quickly and get that person up to speed. And I know John's also got training coming up here scheduled for additional water certification. Anybody have questions on the Public Works report? Okay. All right. With that, that concludes, what was that, item M. So we'll move on to item N, informational items not requiring action. We have none. And then item O, executive session.
Yes.
It looks like we are going to request for executive session for matters to which the immediate knowledge of which would clearly have an adverse effect upon the finances of the government entity and attorney-client privilege / potential litigation. And we will need a motion from council to enter into executive session if you wish.
Yes, Mr. Mayor, I would like to motion that we go into executive session, request for executive session with matters, the immediate knowledge of which would clearly have an adverse effect upon the finances of a governmental entity and attorney-client privilege potential litigation.
I'll
Do
second.
we have a second? Okay, Mr. Kohlberg seconds that. All those in favor, Sweat,
Aye.
Kohlberg,
Aye.
Morrison, Rojas,
Aye.
Nathan.
Aye.
Okay, so the motion to go into executive session passes. With that, what we're going to do is we are going to recess. Anyone that's on a Zoom link now that will be, and I'm going to make sure real quick before we do this, before we sign out, we don't need to clarify on the motion that we're inviting the two
Oh, yes,
acting.
sorry.
Yep, that we're
So-
inviting the two acting city managers as well as the our attorney. Is there any objection to that?
No.
Okay, heard. Okay, so for those of you at home, you should have a separate Zoom link for the executive session. So you'll sign out of this, you'll sign back into the executive session, and then with that, we'll stand in recess and we'll see everyone back here within about 5 minutes or so. Thank you.
Okay.
If you can text Laurel, then I'll let Crystal and Michelle know when you guys come back on.
Can do. Thank you, Laurel.
Thank you.